Hi, welcome to the CPIC Resource for Services Cognitive Behavioral Therapy session. I'm Judy Ho, a clinical psychologist on the project, and today I will be introducing you to the BRIGHT program, which is a cognitive behavioral treatment program for clients with depression. A quick overview of what we're going to be doing today. I'm going to have a brief introduction to cognitive behavioral therapy, what it is, and how it works. The CBT Thoughts module will be next. Then we'll introduce the CBT Activities module, and finally we'll look at the CBT People Interactions module. So what is cognitive behavioral therapy? The CBT model says that thoughts, behaviors, and moods are all interrelated, but you can't change a mood directly. So how do you change a mood when you're feeling sad or down or depressed? You'll have to change your thoughts and your behaviors to put your mood on the upswing and get yourself out of depression. Behavior includes doing activities as well as interactions with other people. The program we're going to be looking at today will be highlighting these three components: the thoughts component, the activities component, and the people interactions component. Some of the basic principles of CBT are that CBT is educative. The CBT teaches clients to be their own therapist, gives them skills that they can use when they're not in session with you. CBT is also very collaborative. The client and the therapist are working together to solve problems, and there is a guided discovery process. CBT is goal-oriented. The client often comes in with a goal or several goals, and the therapist thinks about how they can work towards these goals using CBT principles. CBT is structured and it's time limited. This program, for example, is designed to be done in 12 to 16 sessions or 3 to 4 months. CBT is also very problem focused. It takes specific problems that the client is having in their daily lives and tries to solve them one by one. And finally, CBT entails lots of practice. This is why in CBT you often assign the clients a homework assignment. This is a way for them to practice those skills outside of therapy and to review it when they come back to see you. And just a quick overview of CBT studies. CBT has been very well studied, over 75 clinical trials and numerous effectiveness studies since 1977. It's as effective as antidepressant medication, and a CBT plus medication combination may be more helpful for those who are very severely depressed or chronically ill. CBT is actually better than antidepressants in preventing relapse a year after treatment and 2 years after treatment. And CBT is very cost effective because it's cheaper than antidepressants. It's a great alternative for clients who are feeling a little bit wary about taking medication. This is a really great way to get them the treatment that they need if they're not liking having medication. And CBT has been shown to be effective for ethnic minority populations as well as undereducated populations and low-income populations as well. The BRIGHT CBT program has 3 modules, which I've discussed briefly earlier. There's Module 1, which deals with how thoughts affect your mood. There are 4 sessions here. Module 2 also has 4 sessions, and it deals with how activities affect your mood. And finally, Module 3 has how people interactions affect your mood, and also 4 sessions. So the total number of CBT sessions is 12 sessions. I wanted to overview the structure of all CBT sessions. The first thing that you do is you review concepts and homework. Then there's an education portion. How thoughts, activities, and people interactions relate to depression are the things we'll be focusing on here. Then you teach a new skill to help them improve their mood. After teaching the skill, you practice this new skill with your client in session. And finally, you assign homework outside of session for them to review this new skill, and you also have a feedback session so the client can have some time to talk to you about the things they liked and didn't like about the session. I put on here a list of all the CPIC resources that are available to you online. There's a provider's guide in both English and Spanish, as well as the provider's manual for individual therapy in English and Spanish, and a provider's manual for groups in English and Spanish. Also, the client has an English and Spanish version of individual manuals as well as group manuals. So let's take a look at Module 1, which deals with cognitions or thoughts and depression. The Thoughts module, as I mentioned, has 4 sessions. The first session deals with how your thoughts and moods are connected. This is where you start to introduce the CBT model to your client and get them to understand how thoughts are linked to your mood. In session 2, you're helping the client to identify harmful and helpful thoughts. In session 3, you're teaching them the skill to talk back to their harmful thoughts and make them into a more helpful thought. In session 4, you're focusing on how to have helpful thoughts so that they can improve their mood. So in session 1, you start by educating the client about the CBT cycle. Session 1 is titled, Your Thoughts and Moods Are Connected. So how does CBT treat depression? Your clients might want to know the answer to this question. And CBT helps the client by breaking down the downward spiral of depression and teaches them to change their thoughts, activities, and people interactions to help them improve their mood. Because all of these 3 things are connected, you can make a change in one area to affect all the other areas. So you can see here that there are some cycles of depression and harmful thoughts, depression and fewer negative activities, and depression or fewer negative people interactions. So these 3 cycles actually illustrate the 3 parts of this program: the thoughts part, the activities part, and the people interactions part. In session 2, you're helping them identify harmful and helpful thoughts. So you're teaching them ideas about the common habits of harmful thinking, which is very common for clients who have depression. Many clients with depression have all or nothing thinking. Either everything's going to be great or it's all going to be bad. So there's no in between, there's no moderation. A lot of depressed clients also have negative fortune telling. Before they even attempt an activity or a project, they'll just say, well, you know what, I'm going to fail it anyway, so why do I care? Everything bad always happens to me. So a lot of depressed clients have these types of harmful thoughts, which actually lead them to have more depressed thoughts. There's also exaggerating. So if something small happened, even if it's negative, a lot of depressed clients will end up exaggerating that effect. So something very small happened and they're going to think that it's a catastrophe. Another thing that clients do is labeling, either themselves or others. A lot of depressed clients can be very hard on themselves. So they'll say things like, I'm a loser, I'm stupid, I'm good for nothing. And these types of things, again, lead to more depressive thoughts. And another harmful thinking idea is blaming oneself. So anything that happens, the client might just blame themselves. It's all my fault. They wouldn't be so upset if it wasn't for me, and really just taking all the blame on themselves. So all of these patterns are harmful thinking patterns that can lead to more depression. In session 2, you're really trying to identify these harmful thoughts and help them to see it for the first time, to see it for what it is, and to start to evaluate whether or not it's actually true in real life. So this is a worksheet from the page 27 of the thoughts module in the program. And this is where you teach them to identify their harmful thoughts. So it says, try to remember a time in the last week when you felt really low. Close your eyes and try to picture yourself in the situation you were in then. What were you thinking? Please write down your thoughts. And then after they write down their thoughts, you help them through these questions. How do these thoughts make you feel? And are these thoughts accurate, complete, and balanced? And we'll talk a little bit more about this in the next slides. And just to reiterate, today we're really having an overview of this treatment program. There's actually a lot of detail, and please feel free to explore all the different pages in this manual using the CPIC website. We're just going through a very quick overview of different elements of these sessions for you to get a sampling of what CBT is about. Session 3 of the Thoughts module teaches you to talk back to your harmful thoughts using a skill called catch it, check it, and change it. So catch it is to notice your thoughts. This is why in session 2 you're really going through all the different types of patterns that depressed clients can have, because you're trying to teach them to catch their own cognitions. So notice your thoughts. That's one of the biggest things here. And then you want to check it. Be your own detective. Decide if this thought is helpful or harmful. Gather evidence for your thoughts and evaluate your thoughts. Is it accurate, complete, balanced? So accurate means, is this actually true? Complete means, am I really looking at the whole picture? And balance means, am I looking at both the pros and cons, both the positive and the negative sides of a situation? And then finally, you change it. You want to try to teach the client to replace these harmful thoughts with helpful thoughts. And helpful thoughts doesn't mean that something is completely over the top, something that they can't believe. It actually has to be very realistic and grounded in reality. So let me show you some examples. This is from page 29 of the Thoughts module and page 31. So when clients have problems identifying their thought patterns, it's really useful to show this chart to them with these different ideas of what harmful thoughts are and what helpful thoughts are as examples. So you can see harmful thoughts are very catastrophic. I've lost everything. There's no love in the world. It's very black and white. The helpful thoughts are not totally over the moon, but they're just more realistic, like, I've lost some of my belongings, but I have my family and I have other good things in my life. Even though things are bad right now, they're bound to get better. So for the clients who are kind of skeptical of this, let them know that the helpful thoughts are not just completely unrealistic positive things. They're really just things that are more balanced, more accurate, and more complete.